in conversation with Dr. Pragati Shubha, facial plastic surgeon at Recon, Gurgaon, to talk about eyelid rejuvenation surgery, also known as blepharoplasty. Good evening, Dr. Pragati.
Hello.
Before we talk about blepharoplasty, please tell us what are the age-related changes that we see in eyelids and what causes them?
Well, with aging, like the rest of the facial skin, the upper eyelids and the lower eyelid skin also goes through change in tone and texture. What happens is, due to loss of elasticity, there is excessive skin sagging on our upper eyelids and there is creasing of the excessive skin in our lower eyelids. There are these fat pads around our eyelids which are kept in place by a thin membrane. Now, there is also loss of elasticity in that membrane which weakens with time and causes the fat pad to protrude forwards and causes what is known as puffy eyes or under eye bags. An important thing to remember is that there is also loss of elasticity in our forehead skin. This causes our eyebrows to droop. This drooping of eyebrows causes worsening of the appearance of the upper eyelid skin sagging. In some patients, these changes can appear at a younger age, which could be due to genetics or some medical disorder like a thyroid imbalance. All these changes together give your face that tired, sad and angry appearance that you were talking about.
So do tell us now what is blepharoplasty and how does it help in rejuvenating the eyelids?
Well, blepharoplasty, as you said, is the plastic surgery of the eyelids. It is done on the upper eyelids or the lower eyelids to give it a more youthful appearance. During blepharoplasty, we can either remove excessive skin that has been sagging or remove fat pads that have protruded or prolapsed, or we could do a combination of both. It helps in giving the eyelids and the overall face a well-rested youthful appearance.
And are there different kinds of blepharoplasty?
Well, there are two types of blepharoplasty, an upper blepharoplasty for the upper eyelids and a lower blepharoplasty for the lower eyelids.
So now we know about the types, so what exactly does the surgery entail?
Both upper and lower blepharoplasty are carried out as daycare procedures under local anesthesia. Before the surgery starts, the surgeon usually marks your upper eyelids and your lower eyelids with a pen to determine how much skin needs to be excised, what are the positions of the fat pads that needs to be excised. And during surgery, incisions or cuts are given along the natural lines of your eyelids. So, when we are talking about the upper eyelids, it is along your natural crease, and along the lower eyelids, it is along the lash line. Then, like I said, we either remove excessive skin or we remove excessive fat, or we can do a combination of both, and then we stitch back these incisions with fine sutures. In some cases, patients come to us only with under eye bags and no sagging of the skin. In that case, we can do a transconjunctival fat pad removal where the cut is given inside the eye and there is no external scars. In fact, there are no scars after blepharoplasty which are very apparent or visible because they are easily camouflaged in the natural crease lines of our eyelids. After surgery, the incisions are closed with fine sutures which are removed around day 7, day 10.
So if a patient is interested in getting both the upper and lower blepharoplasty at the same go, is that a possibility?
Yes, of course, we can do both upper and lower lid blepharoplasty at the same time. In fact, it's commonly done for a lot of patients. Though if I had to say, an upper blepharoplasty is done more commonly than a lower blepharoplasty.
Does blepharoplasty also correct a droopy eyebrow or crow's feet and also dark circles in some cases?
That's an interesting question. Blepharoplasty alone does not take care of these things, but when combined with a brow lift or a Botox injection, it does take care of your crow's feet and your drooping eyebrows. In fact, this enhances the results of surgery. However, blepharoplasty has no role to play in your under eye dark circles, no.
So it sounds simple enough, but how does the recovery process happen?
Well, after surgery, there is definitely going to be some amount of swelling and bruising around the eyelids, and there is more discomfort and more swelling in the first 24 hours. This does gradually start to decline and subside and is significantly improved by the end of 2 weeks. We also advise the patients to take cold compresses around the eyes. During your post-op period, you can carry on with your light activity or your daily routine activities, but we do tell you to refrain from any heavy exercises or intense activities for at least 2 to 3 weeks post-op. You can return to work after 2 weeks. Gross results of surgery are also visible by the end of 2 weeks, but the final results are usually appreciable at the end of 2 months.
Thank you, Dr. Pragati.
My pleasure.
You can schedule a blepharoplasty appointment with Dr. Pragati Shubha by calling on the below mentioned numbers. You can also look us up online at www.reconfacialsurgery.com.